So we're all becoming very familiar now with this strange creature which has changed our lives, perhaps forever. And it's meant all of these things for us, and these big challenges for ICMDA. As I say, I had 8 meetings planned. I had to cancel all of them, and I nearly ended up imprisoned in a hospital in Bishkek in Kyrgyzstan, because I was about to get on a plane to fly to actually what was going to be a synonym conference, our first in Kazakhstan in the middle of March. And then I learned that a British national who had no symptoms at all, had arrived in Bishkek, where I was going on the way, and had been taken off the plane, put in a hospital under unarmed guard with no food. And the embassy was told to look after this person. I thought, well, perhaps I won't go through Bishkek. I tried to go directly to Kazakhstan, but within 24 hours, Kazakhstan had closed as well, because they'd had their first 2 cases. And so we're facing these challenges, aren't we? Cancelled events, conference bursaries. We had almost close to £20,000 of conference bursaries lined up for the Pan-African Conference. And of course, none of them are now needed unless it runs again. Travel is impossible even within countries, let alone between countries. And then ICMDA also faced the challenges of falling income as well, because particularly the CMDA US conference, which always gives very generously to ICMDA from the conference offering, they cancel the conference, so it no longer happens. And physical meetings were impossible. So we initially thought, this is terrible, what are we going to do? And then we started to see that there were lots of opportunities. And so I'll just go through some of the ways that we have adapted in the last few months, and then that will lead on into a discussion about how we can best use this time of COVID that God's given us. So this is from the ICMDA website, and you can see events cancelled, postponed, cancelled, postponed, 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 cancelled, and so on. And so it goes on 3 months now, and some later in the year have also been cancelled. Now, these are some of the new things that we've done, and I'll go through each of them in turn. You can see we started in the middle of March, and we're now into May, and there are other things coming up. So the first thing to take note of is that the key to all of these resources and things is the ICMDA website, which you already know. And we launched this, as you remember, back in October last year at the summit in St Albans in the UK. And the reason we redesigned it was we wanted a site that could be much more accessible on any kind of device, so that you could read it on your phone or any other mobile device or laptop as well. And we've got that thanks to a lot of hard work from Josh and a designer who helped us with that. And we did it at very minimal cost indeed. So this is the key to all the resources, to membership and so on. So if you're not familiar with the website, do spend a good amount of time on it so you know where things are. The first thing we did in March was to set up a web portal. So we decided that our member countries all around the world, we couldn't supply resources, but we could point to resources. And so we set up this originally as a list on a web page, and then it developed into this thing now with 12 different panels. Each one beneath it has a drop-down menu, and each thing on the drop-down menu goes to other pages on other people's sites all around the world. So you've got general health advice, resources from ICMDA members, stuff about the webinars, Christian books and articles, and so on. And we initially were updating this every 2 or 3 days or so. We now do it every 1 or 2 weeks, because there's not as much new stuff coming out, but you'll find it's a very good source of ideas and reliable information. A day later, we launched the ICMDA blogs, and this was really an opportunity for field workers and others to be able to write into the situation of COVID. We've published 26 posts so far, and they've been translated into 4 different languages by teams within ICMDA. And we're incredibly grateful for all the hard work, both from the authors and the translators. We now have every single blog post available in Portuguese. So there is a challenge for the Spanish, French, and Russian and other languages as well. And we're now in a situation where we have a bit of a backlog. We've got at least half a dozen posts that require some editing before they go up. But we're currently just struggling with our editorial capacity. But the aim is to keep these going up. We were putting up a blog every day for a while. We're now doing 1 or 2 a week. And we're thinking that as we go into the future and we move beyond COVID, that this could be used for writing on any subject at the Christian medical and dental interface. So there's just one example, caring for your mind during lockdown. And then there's an article here by Jorge on the crisis helpline they set up in Uruguay. Incidentally, if you want to find the language versions, then this is the slide, but if you click on the website on categories, then it will bring up language translations, and then you can find all the language versions for all the blogs. The next thing we did was we set up a YouTube channel on the internet, on YouTube, because all the software is freely available. And initially what we did was just to look for everything that we could find from ICMDA that was already on YouTube, and there was material from at least 3 World Congresses that was out there. And so we've arranged it all into playlists, and if you click on the playlist button here, it will bring up all of the YouTube videos that have been categorized into individual talks or songs or whatever. That's where the song came that we didn't hear earlier today from the 2014 World Congress in Rotterdam. And the webinars we're running, which I'll come to, they're all posted up there as well. And the video that I just showed you earlier, the 5-minute video with the PowerPoint presentation on ICMDA, that's there as well. And so we'll put stuff up as it comes, and that will be a one-stop shop for you to be able to easily access videos. And we expect to get a really good bank of resources up there in addition to that that's already on the training site at the moment. So let us know of other things. If you find some great ICMDA videos that aren't there, then please just send us the URLs and we'll link them into that. The next thing we did a few days later was to launch a COVID-19 Bulletin. And there's been 3 issues of this out so far. It comes out every 2 weeks. And we plan to keep it really, really short. And so each one has just 8 little items, no more than 100 words or so on each, with a picture and with links. And that goes out to our entire mailing list of 2,400 people. But all the back issues are accessible via the COVID web portal as well. So you can go back and find them. I don't know about you, but there's just so much stuff coming through on WhatsApp and so on. And it's very, very difficult to find things again, unless you know exactly where to look. So what we've done here is to take the very best material, which we think is going to be useful, and then we just packaged it all together so that it's very easy for you to find in the future. The next thing we did was to start the webinar series, and this came out of discussions on the senior team and also amongst the AEOs that people were running webinars, but no one was really doing things that were both Christian and medical and related to COVID. So we decided that we would start running webinars. So we've set up a webinar page again on the website that you can see here. And Santosh kicked off with the first one, giving reflections of the care of COVID patients in low resource settings. And then we've now run 7 of those So the last one was from Patrick Dixon. We've had 6 more speakers confirmed. We've got some fantastic speakers coming up. And our plan is to keep running 2 every week. We've had attendances of between 100 and 270 per webinar, people from all over the world. But in most places of the world, people don't really know about them. So we're getting most of our watchers are coming just from 1 or 2 areas of the world. So we think there's a lot more potential for these. We record every single one. We put them all on the YouTube channel, and they've been watched again there. And we're planning forward, after the pandemic settles down, we would then just keep running webinars, probably more like 1 a week or every 2 weeks or perhaps every month or so at a lower rate, but covering all sorts of issues that are of interest to ICMDA people around the world. So the question is, you know, how we can better advertise them throughout our network. And they're all there to watch again, but we've been really pleased at the quality and the turnouts. So there's Santos's first one. They're advertised on WhatsApp, on the emails and so on. The next thing that we're working on is the Mission Hospitals Project, because there are over 1,000 church and mission hospitals in Africa and Asia, and many of them are unprepared for the pandemic. And some of them need training, some of them need testing kits, PPE, oxygen delivery apparatus, ventilators, and so on. There's a whole lot of different things. And we are not in a position where we can supply most of those, although we can network with others who are. But the thing that we think we can do is to provide training. And we've been working with CMC Vellore in India on the Diploma of Family Medicine, which I'll come up to very shortly. But CMC Vellore have also developed a 9-module training course on COVID preparedness, and they're currently piloting it in 25 hospitals in India. And we've had preliminary discussions with them about, could we take this course outside India and use it in other countries in Asia and in Africa. And so at the moment, we're working together on a database of mission hospitals throughout the African and Asian region. And we're planning after that a pilot in 20 hospitals across the Africa and Asian regions. So we're seeking some support from USAID. We put in an application for a grant a couple of weeks ago. We haven't heard anything yet. We did have some good discussions with them, but we don't know if that will come to anything. But we don't actually need any money to start it off in a small way. And we're just trusting the Lord as we push forward that if he wants this to go ahead, then the money will come to make it expand. So this is an Excel spreadsheet of the database as it's being put together. And you can see we're just wanting basic information, the name of the institution, the mission that runs them, what country and region they're in, how many beds they have, directors' names and contacts and so on, and websites and all the rest, so that we can then survey these places. So we're gradually working through that, and that would be another thing that people could help with. The Diploma in Family Medicine, which you will have heard about before, and Santos spoke about it at the summit last year. This has finally been launched. It happened on the 4th of May this year, and we had 33 students from 15 countries who started on the course on the 4th of May. So it's a 2-year course, blended, because some of it's face-to-face, but most of it is online, and it leads to an international postgraduate diploma in family medicine. And it's a joint project between ICMDA, CMC Vellore, who developed the course, and Loma Linda University in California in the US, who have validated the course. Now the cost is £3,000 per year. That's $4,000 over 2 years. And of those who enrolled, only 14 of them were able to pay for half or the full first year. And we thought we would have to turn the others away because we had no scholarship money available. And we were praying about this, And then all of a sudden, we heard from a trust in East Asia who provided us with a £30,000 grant. That's $40,000. And so that enabled us to grant scholarships of £1,500 to 19 students, and meant that we could start with 33 of them. So the course is taught online over 15 modules, and then there are contact sessions, COVID allowing, in 6 African and Asian mission hospitals later this year. But as always, we've started and proceeded by faith, and we trust that the Lord will raise the finances that we need to take it forward. So if students are able to pay, they do. If someone else can sponsor them, that's great. If they can pay for part of the course, then we can provide scholarships to cover the rest going forward. So that's now underway. There's the advert on the website. And those are the 6 centres where we do the 1-week contact sessions, 3 in Asia and 3 in Africa. So I think that's the end of the slideshow on COVID.